Of course, yes. The program has to be recorded. It is no doubt a very fantastic tool, very fantastic therapy. But over a period of time, especially after the we say post-COVID era or post-COVID time, many things has changed within the human system. There are a lot of changes, what we have seen, what we have observed in patients, and what we have observed in the problems people are facing day to day. So today, it is a basic section where I will be discussing about what is this Guasa. I will also provide you all with a small, write up about Guasa, Bible, etc. Bible is not today's topic anyway. It is Guasa. So what is Guasa? How it can be performed? What are the conditions where you can depend yourself on Guasa? And what are the accessory, things which you need to follow so that you start getting the benefit in the symptoms, signs and symptoms what you have within the body. Okay, so let's begin and let's keep it interactive. Okay, you have any doubts, you can please we can share among ourselves and we can try to understand this particular concept. So first and foremost, to understand what is a Guasa. See, Guasa is a physical therapy which is done on the skin, on the body, outside the body, external part of the body. No medicines are given, and it is a massage like treatment. It's a massage like therapy. In this therapy, we will be using a specialized board and oil. We'll be using this board and oil. We'll come to know what is the importance of this oil and board in few slides from now. So Gosa is originated. It's basically from the Marma points or Kalaripattu what we have in India, but then it has excelled in China and in TCM. They made it a very good practice now. And across the East, now in the West, Germany, US, Canada, they are following Gosa, right? And it's so easy. So that's why you are able to learn so fast, so quick, right? But basically, what is this? It is a very simple therapy where, with the help of a board, we scrap on the skin or the affected area. Say, for example, if you have pain in this area, so we are going to apply the oil and then we move the board. So we are going to do a massage like treatment on the affected area of the skin. On doing that, what happens? Number one, the pain reduces. Whatever is the pain, whether it is muscular in origin, vascular in origin, or neural in origin, it reduces. And the first and foremost thing what a patient wants is reduction in pain. So the pain is reduced. Once the pain is reduced, automatically there will be hormonal balance created in the body. But ultimately, the first thing, see, I'm taking a board and I'm scraping on the skin. So what happens when you do that? When you do that, there is a better circulation of blood, of lymph, of energy to the affected area. First and foremost, why do you have pain? You have pain because there is deficit of energy circulation, lymphatic movements, and your blood circulation to the area. Now, what is so great about blood circulation? What happens if the blood circulation is reduced? Basic ingredient for the production of energy, oxygen, is deprived. It will be reduced. So if oxygen is reduced, then what happens? The metabolic process, the process of production of ATP, the energy in the body is reduced. And when it is reduced for 1 day, nothing will happen. 2 day, nothing will happen. But for a constant period of time, when it is reduced, you start getting symptoms. You start getting dysfunction in the body. That's why the first and foremost thing what we do is when we do the massage by using this tool, when you move on the skin, then immediately what happens is there is a rush of blood. There is a better vascularity in the area, better, circulation of blood and lymph in the area. Responding to that will be better oxygen and enhanced metabolism. By improving the oxygen, what can happen? Yes, we call it as anti-aging factor. Premature death of cells in the affected area will be reduced. Right? There will be increased oxygenation. There will be removal of toxins from the area. So any type of blockages can be removed. Increased metabolism. So whatever you're eating is getting digested, it's getting absorbed and then utilized by the cells. So that is metabolism. Production of ATP is much better. And most important thing, there is normalization of hormonal secretion in the body, which enhances the immune system, improved circulation, and it improves the flexibility and balance in the musculoskeletal system. So majority of the diseases, if you know, you can think about any disease. Somebody in your family might be suffering or some of your friends might be suffering. Just think about it. The ultimate thing which happens to the patient will never come and tell you that he is having an organ problem. Patient will always tell that they have a joint problem. They cannot move their hands. They cannot move their legs. Some people cannot stand. Some people cannot sit. You know, so these are the complaints, what they say. But you think it is because of the joint they have a problem? You think it is because of the muscles in the area they have a problem? No. It is all a reflection of the internal health of a person. If your if your lungs are dysfunctional, small intestines are dysfunctional. Dysfunction means they are not functioning properly, right? Either they are functioning less or more than what is required. That we call it as a dysfunction. So here in this case, we don't say they have a disease, but there is a dysfunction. And whenever there is a dysfunction, you know what? People usually complain of shoulder pain. They will not say they have an intestine problem. They will never say they will have a lung problem, but they will complain of shoulder pain. Because the ultimate thing what the patient recognizes in the body is the flexibility of movement of his musculoskeletal system. And that is what we are going to achieve in Guasa. So to perform this Guasa, you have to use a prescribed Guasa oil. So you have a specialized oil to use. And you have to use non-porous, non-conductive Guasa boards. Now, what is this non-porous and non-conductive Guasa board? Non-porous means the board itself doesn't have any holes, any minute, tiny microscopic holes. Why? Because if it is having a hole like that, then there is a possibility of the debris or the dead cell or the oil to get accumulated in the area, and over a period of time it will get contaminated. That's why you should not use porous substances. Wood is a porous substance. Don't use the material made out of wood. Do we get this? So any type of porous materials are not allowed. You are not supposed to use. Not only porous, non-porous, but it should also be non-conductive. What is the meaning of non-conduction? It means that whatever is the energy system of the patient, it should not conduct that particular energy to the therapist, to the person who's performing the kosa. You understand? So the energy systems travel. And if you have an insulator in between, it is the Guasa board. Guasa board will act as a insulator. So it protects the therapist, it protects the patient. There is no bidirectional energy transfer from patient to therapist and therapist to patient. So both are safe. And if you want to do Guasa, one of the most important requirement is the patient should drink water. He should drink water, preferably before Guasa and after Guasa. I see most of the people don't follow this. When you have the Guasa done on your body, when a particular therapy is being done on your body, it acts as a stimuli. Stimuli means you take a pin and you poke yourself. Immediately your body will retract it. Why? Because it is a response to stimuli. When you say an organ is functioning normally, what do we mean by that? We mean that the organ is responding to the demands, responding to the stimuli in a normal rate. That is the meaning of that. So, if your Guasa therapy has to be successful, patient should be hydrated. So, patient should drink water. Even in case of kidney failure, if a stent is placed recently to a patient, the patient will hesitate in drinking water. Doctors would have suggested that please drink less amount of water so that there is less stress on your heart. And the patient seldom don't drink water at all. That is not acceptable. So there should be a very important regime which you have to do with water. You will have to drink water before and after the Guasa therapy. Very important. And immediately after Guasa, when we perform the therapy, you should not wash the area. You should not take bath. Many people say, oh, I have applied oil, so it is oily, so I should wash it. They think of hygiene. Let me tell them that hygiene is not from outside place. Hygiene is from inside the body. How clean are you from inside is the definition of hygiene. Many people, they wash their hand 20 times. They use sanitizer. The COVID condition, so you apply sanitizer, you keep virus free your hands. Inside they have diabetes, they have hypertension, they have nephro problem, they have heart problems, respiratory problems, but they wash their hand. They say, I am very hygienic. Peep inside your body. And when you peep inside your body, you see so many organs and systems inside. And then you can think about, how hygienic we are. And facial Guasa is not the concept. So that is only for beautification part of it. We are not going to look into that anyway, right? And of course, these Guasa boards are also available in different shapes. And what we prescribe is a water buffalo horn boards. So it's a very special boards which are available, water buffalo horn, because these boards are not just non-porous. They are tamed, or they are trained to absorb pathologic heat from the body. And when you perform the Guasa usually is performed on the skin. But let me tell you that its effect is on the meridians. And meridians are the channels through which energy flows in the body, which connects the external to the internal, which regulates the proper functioning of your organs and systems. So meridians are so very important in the body. Why? Because of their function. They are the prime, channels which can tell you whether your organ is normal or abnormal. And luckily for us, These meridians come superficial on the skin across the body, and they are accessible through what is called as acupoints. And when you perform the guasa anywhere on the skin, it is going to affect the acupoints. It is going to trigger the acupoints. And because it triggers the acupoints, there are tremendous benefits which it takes within the body in helping the organs function in a normal way. Do we get this? So it is not just with the blood circulation. It is not just with oxygen. It is with the life energy, the chi energy. It is with the prana, which is how the body is going to function in a very, very normal fashion, in a homeostatic mechanism, in a balanced mechanism. Do we get this? So ultimately, we are dealing with meridians. And meridians are the first line of communication in the body. So many people, we say the moment a person becomes a patient, for example, first thing is they'll check what is the heart rate, what is the blood pressure, isn't it? So don't we do that? What is your heart rate? What is your blood pressure? What else? We say respiratory rate. What is all this? These are all the parameters which are created by the functioning of organs. But these parameters are guided by the meridians. Remember that if a person is having a heart rate of around 72 beats per minute, it is not because of the heart. It is because of the environment and condition within the body. Are we able to understand this? This environment and condition is created by whom? By the psychology and the physiology of the body. So all your physiological changes, what you observe, is in a way triggered, it's monitored by the psychological pathway. So psychology is very important. And see, for example, if you're stressed up, if you're angry, for example, maybe for a few seconds, what happens to the blood pressure? It shoots. What happens to the heart rate? It increases. Sometimes it can lead to palpitations. We cannot say that a person is having a heart problem, isn't it? Because that is the nature, that is how the response happens in the body. And these responses through the physiology and the psychological pathway is done by the meridian system. That's why meridians play a very important role. So when in a therapy, you work on the meridian, improving the blood circulation, improving the energy flow, and thereby immediately there is a reduction in the pain. Pain is a very important symptom, and pain reduces. And the moment pain reduces, automatically the patient is happy, isn't it? They become happy. They say, oh, the symptom has reduced, the pain is reduced, so that's fine. And sometimes there is a repetition which is required. You may have to repeat it, and the repetition is done by you in your house. So that's why always remember that we are not working solely on the skin. It is the more intrinsic pathways within the system called as meridians. And just for your information, here we have 72,000 nadis in the body, but it's impossible to remember. So they have condensed it. And now they say we have 12 major meridians on the right side of the body, 12 major meridians on the left side of the body. Very easy to remember, okay? How many months in a year? 12 months in a year. That's it. You will never forget it. So there are 12 major meridians in the body corresponding to 12 major organs. So heart meridian, lung meridian, kidney meridian, liver meridian, etc. So every organ has its own meridian system, and it flows in the hands, in the body, front and back of the body, in the legs, thighs, calf muscle, everywhere. There is no corner left in the body where you do not have meridian approach or meridian reach. So anywhere in the body. Got it? So that's enough for us to understand in basic that what is Guasa, and when you perform Guasa, what happens, right? Now, that's why I always tell you that whenever you want to treat yourself or anybody in the body, anybody in your family, first and foremost is don't complicate things. That is very, very bad. I have seen people, if they get a left hand pain, I have seen thousands of cases in my life, right? Left hand pain, they always think that it is connected with the heart, and they get the ECG done, they get the echo done, right? Ultimately, to find out everything is normal. But then why did they get a left hand pain? The left hand pain is first because of the small intestine meridian, large intestine meridian, and the lung meridian. We should never forget this, isn't it? So don't complicate and don't panic. Nothing is going to happen. Nothing will happen. But if you have fear, if you panic, then what happens is the patient's immunity will be dropped. Immunity is not just fighting with bacteria. Don't think that only if bacteria is present in the body, if virus is present in the body, my body should fight it, right? My body should fight, and there should be an immune reaction, and that is called as immunity. Absolutely wrong. Immunity is the ability of the body to thrive under any circumstances. Suppose you're in a hot area now, you move to Himalayas, which is a cold area. Your body should function in such a way that it is still normal at Himalayas. Then we say that is a better homeostatic mechanism, that's a better immune mechanism in the body. Do we get this? So fear is a factor which can bring down this adaptability of the body. First and foremost, I tell you all, leave the fear. Nothing will happen. I will give you one simple example to prove this. You might have seen heart attack is one of the very fearful, what I can say, um, fearful symptom or fearful disease for most of us. If somebody says, oh, he had a heart attack. Oh my goodness, he had a heart attack. Now see, you know when the treatment is given for a heart attack? Hmm? See, listen to me. If you have a back pain, should you be treated when you have a back pain, or you should be treated after the back pain goes away? You tell me. Think about it. When you have pain, you should get the treatment. Correct? When you have the symptom, you should get the treatment. Heart attack is one condition where treatment is given after the heart normalizes. You know this? A person suffered with a heart attack. The condition of this heart attack took around 5 years, 6 years to develop. First point. It did not develop immediately. Right? Some 5 to 6 years, there were some blockages happening, lowered blood circulation to ventricles. One fine day, it stopped responding for a few seconds, please. That is when you have that massive pain, which you call it as heart attack. Now you rush to a hospital after you had an heart attack. They do a ECG. They say, oh, you had a myocardial infarction. You should be admitted immediately. Let me tell you, the heart has started functioning. The electrical signals have started to flow. And then you're taken to OT and, angiogram is done. They say, oh my goodness, you have so much of blockage. Boss, you had this pain and heart attack because you had a blockage. It is physiology, it's understandable. So what is the response of that? What is the result of that? You pay 1 lakh, 1.5 lakh bill, we will place stunt. And a stunt is placed in the artery now. Is your heart dead? It is still alive. It is functioning very much. And then the treatment is done. Do you understand this? So always remember, there are many people who had heart attack, who never went to hospital, nothing happened. We have hundreds of examples. I'm not saying you to neglect it. I'm never saying that you should neglect any symptom in the body. No. I am only telling you that treat all the symptoms in the body with a calm mind. No need to panic. There is nothing which can happen. Do we understand? Only if you neglect a symptom, then there is some possibility of some unwanted things to happen, but not with when you take care of it. Now, the question is when you should take care of it, isn't it? Is it when I have a symptom? Is it when, 10 days before I have a symptom? Is it 1 month before I have a symptom? Or is it continuously everyday process? How do you clean your house? Once in a month? Twice in a month? Yeah, you clean every day. You maintain it every day. Similarly, the body has to be maintained every day. Every day, you have to see to it that your body, your internal system, your entire functions, what is happening in the body, are monitored. Who will monitor? You have to monitor. How will you monitor? Your consciousness is more than sufficient, right? Do you get a good sleep? Are you hungry? Do you feel eating? And when you eat, you enjoy eating, and you see, after eating, you are energized. After waking up from sleep, are you feeling refreshed? You are having a good bowel movement every day. After the bowel movement, you are feeling light. There is no heaviness in the abdominal area. You are healthy, please. You can just tick mark on that day. Oh, fine, I'm fine today. Done. And enjoy the day. Don't build up stress in the body. Stress is something which is very dangerous, right? Slowly it will pile up, and one fine day it's going to show its effect on the body. Now, the question is, how do I know that I have some weakness? If I have pain, okay, I know that I have a pain. You agree? Yes, I have a back pain. Yes, because you can feel that you have a back pain, you say you have a back pain. Is it possible to prevent it? Is there a possible way in which I can know that I have a problem, but if I can know earlier itself that I am going to get this problem, can I take a preventive measure and stop it from happening? 100% you can know, right? We have what is called as pre-symptomatic stages. Pre-symptomatic stages. Please pay attention. If you're having a disturbed sleep, if you're not able to sleep consecutively for 2 days, please, I am repeating, if you are not able to sleep consecutively for 2 days in the night, not in the daytime, in the night, right? And if you do not have any stress, see, the condition is you do not have any stress, but your sleep is disturbed for consecutive 2 days. Immediately start with water. It is a clear indication the body is giving that there is a stress building up in the gastrointestinal system. Are you able to understand? So drink water. You can prevent it. The body has told you that your sleep will be getting disturbed. And if your sleep is getting disturbed, don't take out your mobile and start watching Facebook and WhatsApp. It is an indication given by the body. Are you able to understand? If 2 days, 48 hours is very important. If 2 days you don't have your bowel movement properly, immediately cut down on your diet. The spicy food has to be cut down. Immediate liquid diet has to be administered, right? Liquid diet means no coffee, no tea. Don't involve that in liquid diet, okay? No coffee, no tea. Stop that first. Drink water, right? And the food what you take should be soft. It should not be hard. You see how we are compensating with the symptoms, with what is happening in my body? I don't have any abdominal pain, but the problem is from 2 days I'm not able to go to toilet properly, naturally. So I'm cutting down on my diet. I'm bringing down a soft food now. I'm stopping off all the hard food and I'm taking water. Till when? Till I have a bowel movement. So easy to understand. But sometimes, we are so busy in our life that we don't have time for all these things. Hey, today, if it doesn't happen today, forget it. Who's going to sit in toilet and wait for it? Come, let's go. So we are having a very mechanical life. We are stressed up. Then what happens? You start neglecting things. Negligence is the first step towards disease. You write it down, right? Negligence is the first step towards any disease. A person can never become sick if he is taking care of his body and if he is not neglecting it, neglecting the signs. So it happens so, and still you don't have your symptom. Then what do you do? Once in a while, whenever you feel uneasy, right? You don't feel like being very happy. You don't feel like mingling with people. You're feeling uneasy inside. There is a psychological mood swing, which may be happening. And not in the case of women, of course. Women have mood swings every 28 days once because of the menstrual cycle and hormonal imbalance. We can understand that. What about men? And when such thing is happening, when your food, what food you're taking, you don't like to intend to take that food, you're forcefully having the food, immediately get a biowell scan done. There is a scan called as biowell scan. It is done by scanning the 10 fingers, tip of 10 fingers, and immediately you can come to know if there is any imbalance happening in the body. It's all pre-symptomatic stage. Nothing has reached the organ yet. And then what happens? You know the weakness, you take the precautionary measure, and then that is a time when we start with Guasa, right? When we start with Guasa. And then you will stop the symptom from occurring. But it is too early. People have to, they have to think. They think that I'm so happy, I'm so well, I don't mind. Nothing has happened. Neglect. Ultimately, the imbalance which was there in the meridian system has now reached the organs. Let me tell you, for you to get a positive result in the lab, underline this. For you to get a positive result in the lab, there should be minimum 20 to 25% of functional loss in the corresponding organ. Minimum, I'm telling. Say, for example, you take a blood sample, you give it to the lab. In the lab, for your creatinine levels to rise by 0.1 to 0.2%, how much? 0.1 to 0.2% for it to rise and become abnormal. Your glomeruli apparatus, the filtration apparatus in kidney should have got damaged. You see, when you say creatinine is a very slight increase in creatinine, there is a huge damage in glomerular apparatus. Are you able to understand when you have symptoms? So the problem has reached the organ. Now there is no other way than treating the organ. And there again, compulsorily we do the therapy with Guasa. So Guasa can be administered in pre-symptomatic condition. during symptomatic conditions, before the person is hospitalized. Now, if a person has a serious damage and he goes to a hospital, he's admitted in the hospital, finished. All doors are closed for you. I'll tell you, they will not allow acupuncture, they will not allow acupressure, they will not allow Guasa. Nothing is allowed to the patient other than strong chemotherapy. That is your chemotherapy. Many people think it is only for cancer. The medicines what you take is also chemicals. It is also chemotherapy only. Are you able to understand? So there are certain stages of progression of the problems in the body. So pre-symptomatic condition, symptomatic condition, before the patient is admitted to the hospital, when you perform Guasa, there is a remarkable recovery in the patient. I am telling you, of all the major 12 organ related problems, it could be problem related with respiration or your lungs, problem related with your upper respiratory system, nose, maxillary sinus, ethmoidal sinus, frontal sinus, throat, pharynx, any problem in them can be solved by this. Most important, yeah, in female, we find what is that? Thyroid. You say, oh my goodness, I have thyroid issue. What issue? Either it is hypothyroidism or hyperthyroidism, either of the two things. And majority of the people for lifetime, they are on thyronorm, thyroxine, huh? Without realizing that in initial stages, if you perform Guasa in the respective area, you can be off medicines very shortly. Got it? Then you have the chest related problems, yeah, stiffness in the chest, your heart related problems, gastric problem, epigastric pains, hypochondrial pains, abdominal distension, liver related problems, kidney related problems, right? Urinary bladder, very, very important meridian, urinary bladder related problems. All these things can easily be tackled by the Guasa. So, all these symptoms, what I'm saying, might be a bit complicated in their onset, in their progression, etc. They will not target only one organ. There are multiple organs which are affected. But in meridians, you work on one major meridian, it alters the functioning of the corresponding meridians. It's easy. And the best you see, you can do it by yourself. You don't need to go anywhere even out of your house. Of course, if you have some symptoms, one time you have to visit us, either in Mysore or Bangalore or online. Zoom is a miraculous app now. And if you have this bold and oil with you, you can do it by yourself. You don't have to, wait for anyone. And that is the benefit of Gosa. You can do it by yourself. There is zero side effect. Absolutely zero side effect. And how do you do this? You do this just by applying few drops of oil and then moving the board on your skin. And when you do this, whenever you have a pain or discomfort in an area, that area will become red in color. It's called as a petechiae. This redness indicates that there was a blockage, there was a reduced blood circulation in the area, and now after performing Guasa, all the blockages have exuded the capillaries, they are beneath the skin, and that's why you have that red color, which will vanish in 2 or 3 days, right? I can try to show it to you in slides so that I will also show you some treatments, but if I can try and show it to you in the slides, it will be better. Not in this. Okay, so we can definitely take our Google. Our Google has everything. Okay. And I will tell you how to look into our channel where I have all the treatments listed. So you can go through that. But anyhow, we see we have what is called as Guasha Petike. Guasha Petike. So this is the red color points, what I'm trying to tell you that these points are called as petike, and of course they will stay there for 2 to 3 days. So if you see some of the images, this is a very horrible patient. Don't get frightened by the color. It's a horrible patient, horrible condition. So when we do the guasa, usually it is not painful to the patient at all. See, for shoulder pain, whenever you perform, you see this red mark. Are you able to see? I don't know if you are able to see. Please confirm, anyone, if you are able to see.
Yes, sir, we can see.
Okay, great. So this red mark, what you're seeing, is an indication that there was a reduced blood circulation in the area, and that is why there is some spasm in that particular region. And this is a treatment which is dominantly done for shoulder pains. But you observe this. You have a red mark here. Okay, there is no red mark here. What is the meaning of that? It means that in this area, the symptoms are not there. There is no pain. But this area, there is a spasm, there is a reduction in the blood circulation. So there will be indication of blood in that particular area. So this is called as a PTK, which is a classical sign of a Guasa therapy. No other therapy in the world other than cupping which can give you the toxins visibly like this. Do we have? Do we get this? So we have so many examples. You can look forward, and you find all this is a simple example of a neck pain and a mid shoulder pain there, right? So just by looking at the red mark, we can say what complaint the patient had. And it is not at all difficult. It is very, very easy to analyze in the basic structure of it. Here again, you see this is a shoulder related problems there. And then this is a very classical sign of insomnia. In insomnia, sleeplessness, sternocleidomastoid muscle at the junction will have a petike. Look at that. And this is side of the neck. And side of the neck, when you have a petike here, it indicates that the sternocleidomastoid muscle is having stiffness, and you can also, if you can observe, you can see the stiffness of the muscle there. You see there is a band like muscle there. It's a stiff muscle. So which indicates that there was pain, there was discomfort for the patient in that particular area. Similarly, you see in the back, wherever you do, you're going to get this petike. Hmm? And especially people, if you are going with IT, information technology people, all working on computers, this is very common, neck related problems. Got it. So this is called as a petike, and it will stay there for 2 to 3 days and wind up by itself. You don't need to apply any ointment or hot pack or cold pack, nothing. You don't have to do anything. Just leave it. You understand? So when you do the Guasa, this is a benefit what you can have. Now, what are the different conditions in which you can perform Guasa? I'll tell you. Other than the physical problems in the body. What do we mean by physical problems? Fractures, muscle tear, ligament tear. Are you able to understand? Tumors, right? Cartilage wearing. Anything else? Abscesses, open wound. So all these conditions are physical problem in the body, which requires some physical correction to happen. In case of fractures, the bones have to ossify in a proper way. So there is no, you cannot say you have a fracture, I will do Guasa. No, that will not work. Other than the physical problems like these, physical injuries, any type of system related problems can be addressed with Guasa. Headache, migraine, epilepsy, Alzheimer's, Parkinson's, dementia, attention deficit hyperactivity disorder, ADHD, autism, your vertigo, all these are different names of discomfort, of problems happening in the head area. And let me tell you, all of this, what I've told you right now, do not have any treatment in medical field. You might be wondering, oh, they are given medicines, not at a treatment. The medicines are not given for treatment. In case of headache, you might be taking some paracetamol. Yes, you might be taking some analgesic combination, maybe NSAID. You think they are going to remove your headache permanently? Never. They are going to mask the pain till the dosage is present. After that, your pain will recome. So that's the reason why people having migraine, they suffer a lot. They suffer a lot. So always remember that the headache and migraines have nothing to do with your head. They have some systemic connections, especially with huge amount of occupoints in the head and huge amount of meridians flowing in the head. And any of the meridian, if it shows some imbalance, you can have a headache. Right? So in Guasa, we have a wonderful protocol. It's called as a head Guasa. Head Guasa. And this head Guasa is so powerful, I tell you. It is so powerful. I can just 1 minute. I will come to, okay. And I can come to, all of you can open Google and here you come to our website called as guasaindia.com. And when you come to our website, okay, here, and close this. You have different sections in our website. Okay, our website is not very attractive, okay, but it's very informative. Information is more important than attraction. Anyway, you have some Bible related informations, activities. Come to activities. Probably yes. You see, please go through this. It's a very interesting slides which we have incorporated here. It's in the form of a video. Of course, there is a music, background music. So that's not what I want. You see, my journey started in 2013, and these are all the photographs of 2013 when I started with. And look at the people, look at the crowd. How when we started, especially when I was inducted in Modi Care as a medical advisory panel, Modi Care medical advisory panel. So we used to conduct awareness programs and look at the people, how they used to come, right? And I used to conduct classes for women for their health in Bangalore, across India. I have done. This is in Bagalkot, yeah, North Karnataka area, and this is Mantralaya. You all know our Subhudendra Tirtha. So he had arranged, Shibiram means camp, and nearly we treated 250 people on that day. You'll not believe with Kosa, right? And Swamiji was so very happy to see this therapy. Anyway, so we have done our activities across, and this is what I wanted to show you. This particular training was conducted in Hyderabad, okay, where majority of the complaints was with headache. So we told, why not we address the headache now? And you see, I'm teaching them how to do a head guasa. Head guasa, to perform, hold the board in the hand and do it in the head area, is called as a head guasa. Don't you all comb your hair every day? You comb. But now you are going to do it with the board. This is a guasa board here. So with the board, when you do, the effect on the head is nearly 100 to 200 times improved than your plastic comb. Your plastic comb is going to actually deteriorate the situation. This is going to improve it very, very drastically. So this is what was demonstrated, and it's an acupuncture center there where we had conducted this class. Okay, and this is called as a head gosa. I will teach you all how to do that. And a lot of programs which we have conducted in Bengaluru, and of course in Chennai. This was a ladies club, a Lions club, sorry, in Chennai. Then Vruddhashramas. We have conducted our, even in factories. We have shown them how to perform. So we have done our bit of work, across the community. And she is a very well-known Ayurvedic doctor. And if even for doctors, we have conducted, right? This is in Girinagar camp. Then multiple places, wherever people called us, we went, we showed them. And again, you see, there's one more in Bagalkot teaching them how to do head gosa. Not just that, most of them were interested in certification part of it. So we have conducted certification courses across India, and many people were certified. And our USP is with the head gosa. And believe me, you have any hormonal imbalance, you have any symptoms in the body connected with head, there is no function which can happen without your head. See, all the camps, this is our like USP, our seal. Head Guasa was introduced in Guasa by me. So I have formulated this simple technique, and I have worked it with so many people. I tell you, so many people, they have benefited by this system. And you see, irrespective of community, I have delivered across. Why I am showing this? There are hundreds of people who have learned Guasa today and they are performing for themselves, right? And for those who want to serve the society, you can get certified and you can start, or you can open your own center and you can perform the therapy. And therapy is, one of the best in the world, I can say. And you see, all these things we have been doing right from 2013, continuous cycle, villages, cities, across. And this is our exams also, DGO exam, which was conducted, offline exams. Okay, these are training camps and so many things. And not just that, you see across this slide, please go through this, okay, all of you. This is from a Rotary Club there, and this in our office, is in one more place. He's, if anybody recognizes him, he is our superstar, Raghavendra Rajkumar. So even VVIPs have taken this therapy. He is our Mantralaya Gurus, Sripad Rajmata Guru, and he is a very famous director in India, in Karnataka, AP Arjun. And you see, huge activities. Most of you must recognize him. He is Dr. Rajkumar's son. He is Dr. Rajkumar, his son Puneet Rajkumar. So we happened to be to his house also. We went to his house, we showed him what Guasa is. So it was very helpful for him. But then his brother, Raghavendra Rajkumar. So why I'm showing you? Because it is not, you know, a part of only few people. There are many people who have been benefited by Guasa. Got it? It is there in our website. Please open our website once and go through that. Right? You have the activities part. Then you can also look into the galleries if you want. And in the gallery, You have all these images, all these photos where I am performing Guasa. Look at that. Look at these are the petike, the red marks. What you can see, the courses which we are conducting, and plenty of things, which is present. So go through that. It is all for you. We have added there. And of course, if you want to look for any certified practitioners in your area, you want to get therapy done. So you have a list of certified practitioners there with their phone numbers. These are the certified practitioners with their phone numbers and registration number there. They have their registration number. Phone number is present. You can call them and you can seek their services. So we have the full list of people here, right? Anyway, so that's about our activity. Why I am showing you this is only to tell you that Guasa has not started today by me. It is an ancient program which was started from 5,000 years ago. I have been doing only from 2013, but I have benefited by God's grace more than 17,000 cases. Believe me, you might think, oh my goodness, how is it possible? It is possible. We have done that. And today we are so confident that Guasa can be a boon for every one of us. So first thing I want to show you is how to use Guasa on the head area, right? Many people, they fear the head area. They say, oh my goodness, something happens to the head, everything is gone. Don't fear, right? With Guasa, there is nothing which can happen. And it is in the form of a flat board. And I think it is also there in the form of a comb. If you are interested, we have comb. Okay. And comb is like, you don't need any other additional comb at all. You have this comb, your work is done. Look at that. Beautiful. You can comb for yourself. Anyway, so head guasa is one of the most important techniques which I teach everyone in the guasa system, right? So for you all, I'm just teaching this guasa. So what is this head guasa? It is guasa performed on head. No need of oil. You see, there is no requirement of oil in the head area. So how do you do this? You should first select the center of the head. How do you know what is the center of head? Put your finger in the ears and take it to the top. Wherever your finger touches, that is your virtual center of the head. And then what you do is you take the tip of the board and move 10 times in the forward direction. Move 10 times in the forward direction. This is going to activate a point called as GV20, by Hui point, or the opening to brain. GV20 is opening to brain. In acupuncturists and acupressurists, they very well understand that UB meridian and the governing vessel, they get inside and they are connecting to the brain through GV20 point. Then you move in the forward direction, covering your parietal and frontal bone. Now you're not going to move simply. When you're moving, you should feel any type of pain in the head area. Say, for example, if this particular area is discomfort or paining, repeat it 10 to 15 times in this area, like this. Short strokes for 10 to 15 times. And then back of the head. There you go. Back of the head. The pressure should be firm but not hard. You should hold the board firmly but not too hard. Pressure should not be applied. Oh wow, the occipital area, the suboccipital area, you can perform the guasa. Then the right side of the head. Though you may say that I am covering the same area which I did in frontal, but the direction is different. So you are moving perpendicular to the meridians. So you go right and then the left 10 times, 10 to 15 times on either side. Got it? Then we move on the head area, forehead. So from the center, you move outward 10 to 15 times. From the center, you're going to move outward from the 10 to 15 times, right? And then very, very important is to maintain your eye, because majority of the headache starts with eye irritation, eye strain, difficulty in, eye movements. Then what you do is you work on the eye, below the eye. See, I'm just moving it like this, below the eye, 10 to 15 times, above the eye, but not on the eye, or not on the eyeball. You understand? So I'm moving below and above the eyeball. So I move it 10 to 15 times. The other side, I move it like this. And then I have the 10 to 15 times on the lower and side. Now you say your eyes will become completely fresh. There will be more amount of, you know, fluidity inside, dryness is reduced, and it becomes super fresh. And don't worry about the hairstyle. If you have head, your hairs will always be there. Don't worry about it. Okay. Anyway, I should look good. So that's why I just altered it. Anyway, now this is what is called as head guasa, which should be performed only one time in a day. It hardly takes 1.5 minutes of your time in 24 hours. 1.5 minutes in 24 hours. Negligible time, right? The time taken to log in to your Facebook is around 1 minute 35 seconds on an average. Your head guasa can be completed. You know what happens with this when you do regularly? Yes, if you have headache, the headache will reduce. If you have migraine, the frequency of migraine attacks, the aura, what we call, the vomiting sensation, nausea, what we say, plus the intensity of pain reduces drastically. And within 15 to 20 days, there is a possibility that your migraine, there is nothing called as migraine anymore. All happening naturally. So no headache, migraine intensity reduced, and over a period of time, the migraine reduces, right? Now, very, very important, digestive performances. Anything connected with your digestive system is altered with the head guasa. You may ask how? The gallbladder meridian is right here in this side and this side temple area. The liver meridian directly connects the GV20 point. And these two organs are highly responsible for your digestive system, and they get altered. Got it? So no headache, reduced frequency of migraine, then your digestive system is improved, right? Very important is sleep. The sleep will be improved. But the condition, you should do the guasa in the daytime. If you do the guasa just before going sleep, your brain will become active. And once the brain is active, you cannot sleep. So sleep is induced in guasa when you do it in the daytime. Do we get this? So simple and easiest way. Fifth, very important, fever. You have high body temperature, core body temperature, it reduces. Fever is reduced. Any type of sinus related problem, because we are doing below the eye, anything related with sinus, it will take care. Plus, it's a permanent therapy for stroke, Alzheimer's, dementia, Parkinson's, very, very important. Stage 1 and stage 2 Parkinson, where the tremors have just started. You start with head guasa, immediately within a month and a half, the tremors will stop. Not a single medicine taken. Do we get this? Then, especially when you look into a system where you have hormonal imbalances in female, PCOD, PCOS, several the periods problem, you see, sometimes heavy bleeding, sometimes very scanty bleeding, Everything is connected with the psychology plus the physiology. So this works and it gives you a tremendous amount of benefit just by performing the head guasa. How much time? 1 minute, 30 seconds, max to max in 24 hours time. Easily we can do, right? I tell you, people with epilepsy who were on Gardinal for their lifetime, 75 milligram, lifetime they were supposed to take. Patient is in Bangalore, right? We just told him perform the head gosa. Head gosa was performed and they did it religiously. They did it every day. It was done. And in a span of 2 to 2.5 months, first thing is the doctor reduced the dosage of Cardinal because the frequency of epileptic attack was reduced. So the dosage was reduced. And in a span of around 4 to 5 months, he was off medication. And today, he is leading a wonderful life in Bangalore, no medicines, and he is now promoting Guasa. He is promoting not now, since 2 to 2.5 years now, he is promoting Guasa to all the people who are suffering with the same problem, right? One more testimonial I will give you. There was one patient who had come from, I will not name the patient because of secrecy to be maintained. We should not name the patient. It will not be ethical. So the patient had come from this Malnad side in Karnataka. The problem is the girl was studying in around 8th standard, 9th standard, I believe, 9th standard. And she was not even able to go to school because of severe headache. Because of severe headache. Just excuse me. ಸಂಜೆ ಕ್ಲಾಸ್ ಅಲ್ಲಿ ಇದೀನಿ ಆಮೇಲೆ ಮಾಡ್ಲಾ ಓಕೆ ರೈಟ್ severe headache. She was not able to go to school. Then they came all the way from their place to uh, you know our center in Mysore. And she happened to be my wife's classmate. Who had a problem? My wife's classmate's daughter had a problem. So in a closed loop, closed circle, we fear doing therapies because sometimes it may not, if it is not giving a positive result, then it is not good. So we fear, but not in this case. So they came and I showed them how to do head washer. That's all. I told, don't waste your money anywhere. No MRIs. She was actually advised to undergo a MRI. I told, no MRIs, no medicines, nothing. Leave the girl. And every day you are supposed to do the head guasa. Right? Now they did the head guasa. The headache or the discomfort which the girl had slowly reduced. It tapered down. And one fine day we received a call saying that the whole of the medicines have been stopped and still the girl is not having any symptom. She was very happy. And let me tell you, um, in her board examinations, in 10th standard board examinations, she achieved some 96, 97% marks. She was a rank holder. A girl who was unable to go to school because of migraine became a rank holder, right? And she will not call us uncle, auntie, and all. No, whenever we meet, sometime she just says, "You both are like God to us. We have done nothing. This is the benefit." Head Guasa. I tell you, 100% result. Only thing, you have to have faith and do it. If you do, I'm guaranteeing you that the results are right behind you. They are just waiting for you to do this. So, head guasa is so very powerful, so very fantastic protocol. Yet, It is hidden from mankind, right? These are all written in books, but you don't know which book, isn't it? There are hundreds of books which are available across. I can give you the ISBN numbers of all the books. You can fetch them. If you are interested, then put me a message. I will give you all the ebooks. Condition is you should read them, right? So head guasa is very, very powerful. I tell you, we have done miracles with head guasa. And when we have some case, which we don't understand, we are not robots, to understand everything. A person says one day he's having a stomach pain, next day he will say he's having a back pain, next day he will say he's having some uneasiness, and next day he starts crying in depression. Oh, what do you do? What do you do? Where do you start now? Something you have to do, no? How do you start? The best first gear is the head guasa. You do the head guasa, the patient is calm because it works directly on the meridian channels in the head area. It works directly, and there is no muscle here. You all know, no, there is no muscle other than the frontalis muscle in the front. You don't have any thick muscles here. Of course, a parietal muscle and occipital you have, but they are not so thick as your trapezius and pectoralis. So the results are very quick, very good. So that's the power of head guasa, right? And perform it with faith, right? And every day, whenever you want to comb, you have a comb board like this with you, and you can comb your hair with this. Nothing is going to happen. And moreover, you have finished your therapy. Your head guasa is completed. So you see, two in one. So you can do that. And for head related, this is a protocol what you do. Now you want a shortcut, all of you. Now you say, sir, who is going to use this board? Some ways I keep the board, I lose it. Yeah, it so happens, sir. I'm not joking. In some of the camps when I went, I used to use my regular board, and usually this board which I'm using right now has seen more than 8,000 cases. You see this board? It has seen more than 8,000 cases. It's my personal board. I work with this on the patient, and this has, served me a great service, a fantastic service. I keep it on the table, and it has so happened that my old boards, which I used to perform, they say this board is having some additional power. So there is nothing like that. No additional powers, nothing. It's all pure science. And this board is same as this board, but people think that this having some additional powers. And the moment I keep it on the table and I become busy with something else, and the next time I see there is no board, the board has gone. Somebody has taken. Okay, so I just keep quiet. Okay, somebody it'll benefit. Somebody will use it. You understand? So in every house, one board should be there. I tell you, medical emergencies, I'll show you right now. Medical emergencies, how you can stop with this simple board, right? Then coming to your neck related back problems, your stomach problems, right? Gastric problems, all of them, you have a protocol by using this board itself. So you can perform anything. And all that what I say you, please, you can, I think, open up our website. And in our website, probably if I have given, I think videos. Please come into videos. And in the videos column, yes, in the videos column, you see this? Guasa training and treatment. Simple training, simple treatment for different problems in the body. You can just go through these videos. And you have around 11 to 12 videos to scroll. And you can scroll like this. You see knee pain, neck related problems. We are showing. Then, of course, we have the respiratory system, respiratory related problems, lower back problems. And this is a remarkable case, which I done in Coimbatore in a camp when a person was not able to bend. He was not even able to bend. I will show you. And we have recorded this with his permission. Okay.
Goes to doctor, take injection, painkiller, and then go to work. So that much. Okay. Good. No.
Okay, where exactly it is paining?
You see, I want you to listen to this.
Goes to doctor, take injection, painkiller, and then go to work. So that much.
You see, what was the condition is this patient every day morning, he'll go to a doctor, take a painkiller injection, and then go to the work. Okay, that's what is being narrated by this gentleman. And that much was a misery in the back. Let's
Okay.
Good. Now also.
Okay, where exactly it is paining? Okay. Can you bend forward? Stand up and bend. Stand up and bend. No, not possible. Please observe all this. He cannot stand and bend. Please bend now. That's it. Okay. So let us do Guasa, the lower back area. That's all. Okay. Please take out yourself. No, you are seeing anything in the back? Any wound? Any laceration? Any cuts? Anything is there? Nothing is there, isn't it? But still, he cannot bend, right? And he has severe pain even now. So, the same thing we are going to do. What you learned now, the same thing we will do, but with oil on the skin, and we make the movements. Now he has pain in the lower part, correct, sir? This is the part, this is the entire part where you have pain. What we are going to do is, first check his spinal cord. This is a spinal cord. Yes, we just put few drops of oil, we run the board across the spinal cord. If any place there is a problem, it becomes red. So where it becomes red, there we know that there is a problem, and that is a treatment also. So, anybody come, oil. So slightly you can bend forward. That's enough.
Okay, you see, we are
It's better if you do the upper T, the neck region.
actually, I did not do the therapy also. I asked a participant there to come down and do the therapy, and he came out, and with a lot of curiosity, he started doing the therapy. I hand over the board to him, you see, and he is doing the therapy now.
And with the tip of the board, slowly you move it in the spinal cord. You understand? Take the support and do it slowly. Don't apply more pressure.
And whenever I tell you, we do this offline, and whenever I start explaining, offline, and when I make the patient do this, first time they are really surprised that, wow, something red color is coming out. Okay, it is no magic. If I do, you do, anybody does, the red color will definitely come because that is the property of the body, right? See, he is doing it for the very first time, and still we can see some petty. And then I want you to just look at the results. What happened after this?
Can you see these points? Can you see there? You can see directly also. Otherwise, also I am showing you here. Can you see these points? Anything red there? Yes? Yes, sir. Should I keep it? Yeah, please. Go till down now. Don't allow the oil to go. Yeah. Now go till down. This point. Do it slowly. Okay?
Let me tell you, this protocol is a boon for all the lower back problems. Anybody having lower back pain,
Can anybody
knee
tell where
pain,
the problem is?
lower back pain,
Visible
knee pain.
now?
This is how you are going to
Where
do
it
it.
becomes red. See? It's very much visible. Where it becomes red, that is where the problem was. And for that you take injection elsewhere. You think it is going to get cured? No. Let's see. How much he was bending, how much he can bend. That gives the answer for everything, isn't it? It is done.
So we are just fast forwarding it. We are just moving it forward so that now I'm doing it
Up to down, up to down.
next to the spinal cord. So
Into
spinal
out
cord
we
is
will do, I
completed.
will show you respiratory
Now
case.
we are doing it next to the spinal cord, usually the UB,
Up to down,
urinary
yeah.
bladder meridian point. But you don't need to understand all these names. Just understand that it's next to the spinal cord and we are performing this therapy, right? And then we continued on the back. And because I'm explaining, it is of around 5 minutes, 6 minutes time, but otherwise it's a very easy therapy, right? But what I want you to observe is the result. Now we are doing it on the other side, right side. And in fact, the participant is doing that. I am not doing, the participant is doing, right? So this is only to tell you that how simple it is. Anybody can do. Now you see, we have probably completed all the sectors. Now I asked him to stand up.
Take a deep breath. Right? Okay, lower you have, but can you bend? Try. Did you observe? How is it? So, has he gone further angulation below? Now, bend till you have the pain. Where you have the pain, you show me. No. Here you have pain. Oil. This is called as functional guasa. I told you about functional guasa, no? Let's see now. With the same powder and oil, what I'm going to do, I'm just going to scrap the area. Somebody can take a count of time. Okay, bend madi. Kai kelagudi. Ground kai.
touch பண்ண பாருங்க கிரவுண்ட்ல கை டச் பண்ண பாருங்க
See, can you feel this?
obstruction
Okay, this is called as functional guasa. Done, sir. Now bend. Can you see the changes? It's done just by a board, and further it is done by a person who has just learned this. It's as simple as that. Okay, so this is for the low back. You can test. No, this you do. You would have done this one several times. Do it the reverse way. You know? See? Any pain? Now you bend. Can you see? Actually, you can touch the ground now. Right? See? Done? Good. No more injections. No more injections.
So
See,
did you observe
as
that?
simple as this. Now we will do, I will be showing for a respiratory case.
So similarly, we have done for cases like respiration. We have done for cases like cervical spondylosis. You can go through the playlist in our channel, in our website, guasaindia.com, and you can see whatever is the problem. You try to learn from there, and it is such a simple thing, and the results are enormous. Fantastic results, I tell you. And no more injection to the person, and you saw how flexible it became just with one sitting. But don't stop, right? Guasa is to be performed every day. And if you have the red mark is too bright or it is too much, then you can leave a gap of 1 day and then you can perform once the red mark is reduced. It's reduced in its intensity. So, but repetition is the true mantra of it. So you have to repeat it. Just because your pain has reduced, your discomfort has reduced, you should not stop. You should always repeat 2 or 3 times so that the body becomes normal. The body normalizes on its own. So the website has so many other treatments. Please go through them. Of whatever problems you have, you can go through that. And if you do not get an answer there, right, then you're always welcome to contact us. And our contact number is where? There you go, behind me. Look at that, 8762691297. This is the number. Take down this number and you can please contact us. We will definitely help you in making a protocol for the problems what you might be facing. Is that clear? Now, finally, I always conclude my program by showing you that in case of serious conditions where there is a hypoxic condition in the body, hypoxia is created, right? And where, it becomes really difficult for us to breathe. The oxygen is not going properly in the system and the CVS is getting more and more stressed up. And how do you perform? Now you all see, please, I'll just lower my camera. Now this is called as a cubital fossa. This area is called as cubital fossa. And the outside part of cubital fossa is your lung meridian. Middle part of cubital fossa is your pericardium meridian. Inner part of cubital fossa is your heart meridian. You see, you take the oil, put few drops, 1 or 2 drops in the area. Take the bowl, and then just spread the oil. Now, the lung is here, pericardium is here, and your heart is here. So all the people who have oxygen related issues, hypoxic condition, cardiac problems, those people who have stent placed in the body, for those who are on blood thinners, especially because of cardiovascular condition, you just have to do this. Very simple. Outside lung, pericardium, and heart. You make 10 strokes each, one for lung. Right now I'm working on the lung, you see. I'm working on lung now. And if you have any pain in the area, it indicates a congestion or blood circulation in the lung region. Then the pericardium region, middle. This is more or less a emotional trauma or emotional imbalance in the body that can be corrected with the pericardium. And remember, you get a peticule, which means that there is some stress in that particular area. And then the inner part is with your heart, physical heart. So you move the board 10 to 15 times in the physical heart. You know what happens? It improves the circulatory system to the heart, the coronary arteries. The circulation through the coronary arteries improves and the stress in the myocardium is reduced. Do we get this? So you have to work on the heart channel, heart meridian. Very simple, pericardium, lung, pericardium, and heart. 10 to 15 times. I did not get any peticule. So right now I am not stressed. Okay. So I can as well say that my CVS and oxygen concentration is very, very well, very good. And most of the people, you have motion, if you have motion sickness, right? For example, the moment you sit in the car and even I have not put first gear, they will regurgitate, they will vomit. It is called as what? Motion sickness. And in motion sickness, the majority is not the physiological aspect, but it is a brain to body, brain to vehicle coordination, we say. That is not good. That is not correct. That's why people, the moment of inertia or the momentum is not felt and hence they vomit. Now, for all those people who have this problem, before traveling, before getting into the car or a bus, what you do, you have this part of the hand, inside part of the hand. In the center part, we have pericardium 6 point. Forget about where the point is. You rub the entire area. Just put few drops of oil. And then what you do? See, just put few drops of oil. And then you're going to move from this point towards the wrist area. So you are going to move it like this. See there. That's it, as simple as that. And you know what? This is a therapy which is done for motion sickness. And believe me, this has worked out very well. And vomiting, nausea stops almost instantly. Right? Just a moment. So easy. Just move, move, move. And if you get a pedicure, then you know there is a weakness. Don't need to worry about it. But if you do not get a pedicure, nothing to worry. You have still massaged some area and your pericardium is very happy that you have done that. That's it, 10 to 15 times and your work is done. And you know now you can sit in the car, travel. No more vomiting, no more motion sickness. Within a span of 1 to 2 minutes, you can do it by yourself. No medicines. And that gives you very good analysis in the therapeutic part of it. Yes. Now coming to contraindications where Guasa should not be performed. There are areas, it is not that universally you can do it everywhere. No. For example, when I'm doing a Guasa here in the area, if there is an open wound always have vascular cuts. The blood vessels are cut there, so there is possibility of bleeding. The moment you perform Guasa here, the stress is increased here and there will be bleeding. So whenever there is an open wound, no Guasa can be done. Not on the wound, even before or after the wound, you are not supposed to do the Guasa. No Guasa can be done. Right? Say, for example, there was a fracture in this femur. In this radial bone. So what happened? There is a plate placed. Never perform Guasa on the plate. Are we able to understand this? Now, if there is a fracture and the fracture has healed and it is 6 months beyond the date of fracture, then you can perform Guasa. Otherwise, no, don't perform. The pressures which come may disintegrate the bone. The ossification may go wrong. Right? Minimum is 6 months, we say. So, no question of Guasa during any open wound. No question of Guasa. If you have any plates placed or fracture has just healed, it's ossified just now, new fractures, no. Right? There is absolutely no Guasa which can be performed in a menstruating girl. So when the periods are on, you're not going to perform any Guasa to them. The reason is very simple, that it's going to cause heavy bleeding and there will be hormonal imbalance. So you're not going to perform Guasa during the period times. Right? Now, when a girl conceives, so then the first rule in Guasa says that no head Guasa can be done. Never perform a head Guasa. You may say, okay, sir, it's going to balance the hormones. Then it can become good for the girl. It is not true. The moment you perform the head Guasa, there will be hormonal changes which happens, which may lead to miscarriage in first trimester. So no question of Guasa to be performed on a pregnant lady. In third trimester, if you try to perform Guasa, especially in the lower back, because they will have discomfort in the lower back, in the calf muscles, try to do UB gets activated and there could be a contraction, uterine contraction can start. In fact, it can induce labor. So if you think that 9 months is completed and it's a labor time and head fixing has happened and you want to have a normal labor, perform Guasa in the calf muscle and the ankle joint. It is going to boost the contractions and the cervix will open and there will be a very, a rather painless labor, we can say, because you're inducing the meridians, you're activating the meridians. But Other than this, no Guasa can be performed in a pregnant lady. Do we get this? Guasa can also not be performed in a person who is on heavy blood thinners. If a person is taking too much high dosages of blood thinner, until and unless the blood thinner dosages are reduced, you cannot perform Guasa. It is dangerous because it can lead to heavy bleeding, internal, underneath the skin, because capillaries may open up. And because the blood thinner will not allow the clot to form, so there could be fresh blood also coming into the picture. So that is not advisable when a person is on heavy dosages of blood thinner. What else? That's it. So other than that, you can probably perform Guasa anywhere. In babies to old age, it can be done. Male to female, anybody, the Guasa regime can be functional. It can be performed. Right? Now I open the dais for any questions if you have. Any questions, please? So if you don't have a question, then thank you very much for joining
Quick-
session.
It's a wonderful lecture. Thank you so much. I'm so happy listening to you. A brush up kind of thing for me. Sir, one question about stiff muscle. Can we do Gaza?
Stiff?
Stiff muscles
Yes, of course, yes.
taken as physical condition.
No, stiff muscle, but there is no muscle tear. So
Yes.
though it is physical, of course, but there is no damage to the muscle. So definitely stiff muscles, it is an indication. You see, Guasa is to be performed.
Okay, sir.
Yeah.
And any small cyst-like thing found somewhere?
Okay. Especially with cysts and tumors, depending on the location, you please contact us and personally we can
Yes,
guide
sir.
you whether it can be performed or not.
Okay, sir. Yes, sir. Thank you.
Usually on cysts, we don't encourage you to do, but you are PG, you can definitely do that. But normal people, we do not advise them work on cysts and tumors. Yeah. Any other questions?
Good evening, sir.
Yes.
This is Sheshadri Sharma.
Hello, sir.
Is there any possibility of to treat on prostate gland enlargement?
Okay. Prostate gland enlargement is again a physical issue, as I told you. There is a prostatomegaly. There is an increased prostate gland. So, of course, we can perform in the lower back. Um, lower back, but it is not going to affect the prostate per se, right? You cannot
Yeah.
shrink the prostate. You cannot bring down the size of the prostate. That is not possible. It's swollen is swollen. Nothing can be done. But the symptom of prostate gland enlargement is inconsistent urination. You know what happens? Um, People will get the urgency for urination, but they will not be able to hold it. That is the first sign. If a patient is having that sign, then immediately work in the lower back. Strengthen the lower back muscles. And once the lower back muscles are strengthened, then probably this sign can be reduced. And that is the most embarrassing situation the patient may be because of prostatomegaly. Right? Other than that, you don't have any complications of prostate enlargement in any way. And physical exercises, movement of legs is very important. Like cycling is one example which can be performed, which can bring down the efficacy of this swollen prostate on the urinary bladder.
Thank you, sir. Thank you.
Yeah. Right. So now for shortcuts, please. Quick shortcuts. First thing, you want to know the shortcut for how to reduce the headache, eye-related problems, or any type of discomfort in the in the metabolic areas, any type of discomfort in the sinus related problems like this. You don't even need a board. You don't even need a oil. You need a shortcut for that. The shortcut for that is specs like this. This is called as NV spec, right? It is not an ordinary specs, right? This specs is made out of a volcanic origin stem, right? And this frame emits what is called as negative ions. These are the vitamins of air, and these negative ions can give us superb oxygen concentration in the eye, head area, and you can let go your headache, migraines, any type of heaviness in the head, metabolic disorders, eye related problems, dryness in air, glaucoma, swelling, edema in air, in the eye, and any type of pricking sensation, redness. All these things can reduce just with this spec, and this spec is from Prife International. Prife. It's one of the most valued product across the globe, and people use it. I too use it. So I have been using this. My students know that I have been using it since months now. It's more than 7 to 8 months now since I've been using, and it's giving me very good results, especially reducing my eye strain, reducing my heaviness in the head, and any type of discomfort in the head area. So don't do anything, simply wear this and the work is done. Sir, what do I do when I sleep? Remove the spec, hold it, keep it next to you, next to your bed. It still emits negative ions, right? So that's the power of specs. Now, I told you oxygen is very important, and one of the most important practice what you do in Guasa is to improve the oxygen levels in the body. But what if a person is having a COPD, chronic obstructive pulmonary disorder? He is on asthma, bronchitis. He is having several related association of upper and lower respiratory tract infections. And now remember, please, in Bengaluru, in Karnataka, across India, we are getting back the COVID cases. I don't know why, but they're coming back. Okay. Now you want to prevent yourself from COVID. You want to prevent yourself from bacteria, virus, fungi. How do you do? Yeah, again, wash your hands with sanitizer. I tell you, absolutely no use. Zero. It is all a business gimmick. I'll tell you, nothing is going to happen because something which is airborne cannot be stopped from entering your body. You cannot put sanitizer inside your nose. Not possible. How do you prevent it? So we have the same prime company. Wait a minute. I will try to get it and show it to you. Yes. So that should be fine. Now the same Price company has come out with what is called as an ion shield. Right? I use this. This is my personal ion shield. And what is that? This emits negative ions to the tune of 60 million negative ions per cubic centimeter. And let me tell you, no COVID, no bacteria, no virus, no fungi can pass this. And this was actually invented in Malaysia by Prive during the COVID time. And COVID patients were given this. They were wearing this, and there was a lot of improvement. And now it was marketed across the globe. Now COVID is increasing. So if you do not have, you better buy this one before you lose this. All that what you have to do is you have to switch it on. You see, there is a light which glows. You have to switch it on and wear it like this. That's it. And what it does, it emits negative ions, tremendous amount of negative ions, which can boost the oxidative capacity, antioxidative capacity in the body. And it gives you a charged oxygen, which is so powerful that it can bring down hypoxic conditions in the body like this. People with apnea, sleep apnea, people having a lot of snoring problems, just switch it on, keep it next to the pillow and sleep, and your work is done. It takes care. And this is a highly priced device from Prife International. If you want to implement, I don't say if you want to implement. As a therapist, I would say implement. Right? You have to implement it for your family. You have to implement it for yourself to prevent yourself from different type of problems, and it's just a shortcut. You don't even have to do anything, just wear it and it takes care of your systems much well, right? And again, if you need any additional information, take down the number. Oh, I'm on the wrong side. Take down the number there, 87626912997, and put a WhatsApp message. You will get further information regarding this particular device, right? Thank you very much for joining with me, and have a good health, all of you. Take care. COVID is rising again. I don't know whether it is really it is rising. It had gone for a vacation. It's come back after vacation. I have no idea on that, but protect yourself, protect your family, and protect your uh, world. That's very important. Be healthy, right? Thank you very much.